This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hey everyone, welcome back to another episode of the Outcomes Rocket. I'm so excited to be hosting an outstanding leader in healthcare today. Her name is Dr. Jessica Son. She's an experienced healthcare executive and physician business leader who's focused on strategies to improve the lives and outcomes of Medicare eligible people. As the Chief Medical Officer of Clover Care Services at Clover Health, Dr. Son leads value-based care model strategy and drives clinical excellence of the integrated care management and care delivery network that supports the highest needs for Clover members. She's an extraordinary leader, and I'm so privileged to have her here on the podcast. Dr. Son, welcome, and thanks for joining us.
Thank you. Very excited to be here.
Yeah, look, it's such a pleasure to have you here on the podcast. And so to kick things off, Dr. Son, I'd love if you could just start by telling us a little bit about your experience and in particular your transition from being a primary care practitioner to chief medical officer.
Yeah. So my journey started as an office-based PCP in New York, where I developed a deep respect for continuity of care and the trust that builds over time between a patient and their physician. I later transitioned to house call medicine in Philadelphia County, which gave me even more of an intimate view into the challenges that our patients face, especially the elderly and those with limited mobility. Being in someone's home reveals things to you that you just do not see inside a clinic. Things like limited food in their fridge, medications spilling out of a well-meaning pillbox, social isolation, and all of the things that help you understand why people make the choices that they do. I also started seeing similar patterns across the care settings, patients falling through the cracks, families completely overwhelmed, care that was not well coordinated. I remember visiting one couple after a hospital discharge for yet another heart failure exacerbation. There was a med list, 18 prescriptions long, duplicates, triplicates of what was already in the home, no follow-up, spoiled food in the fridge, and zero support. And so they weren't non-adherent with their meds. They were just on their own. And without the right level of support, they were going to head right back to the hospital for any number of reasons. So I realized in seeing many of these kinds of patients that while I could help one patient, one family at a time, it was really the system that needed changing. So that led me to leadership roles, ultimately to become the chief medical officer at Clover Health, where I now have the chance to design the kind of care that I always wished I could give to my patients. And I'm taking what I learned in both the structured clinical environment, as well as the deeply personal home visits, and apply it at scale. It's really, for me, creating a healthcare experience that's more compassionate, equitable, and personal.
I really love your story, Dr. Son. And from the office to being in the home with folks, seeing the problems firsthand. I love you just call out, it's not adherence. It's just a lot of these folks are on their own and they don't know how to handle the very specific things that need to be done. It's small nudges. Another story I heard is a fold in the carpet, for example, that could lead to a fall risk. There's so many things that could happen that we need to have our eyes on them in order to help overall health. So thank you for sharing that. And look, I will share for many of our listeners, considering a career path like yours, going from a provider to a chief medical officer in an organization like Clover, you're providing great inspiration. So really appreciate you sharing your story.
And you're totally right. It's the things that you're able to see, like that fold in the rug, and just being able to restore dignity into the home as well. So for example, a lot of the patients we take care of, the most convenient bathroom for them is up a set of stairs that they can't make up, right? And so how do we think about connecting them to resources to give that sort of access so that their home becomes a place where they can live and that can also adapt to their journey as well?
Yeah, it's another great example. So let's dig into Clover Health. What does the company do and how is what you do different?
Yeah, so Clover Health is a next gen Medicare Advantage company that integrates tech and care delivery. We've built a tech platform that helps physicians deliver better care and lowers costs, especially for patients who need that higher level of support. I'd say at its center is Clover Assistant, which is our AI-powered tool that gives physicians real-time clinical insights right at the point of care. It's not about replacing judgment or second guessing, but it's about helping doctors catch things earlier, close care gaps, and feel confident in the clinical decisions they're making because that full picture of data is available at their fingertips. And having worked in a very busy PCP office and then in the home, I've seen how much clinicians need that level of support. The day-to-day pressures are very real, and many systems add complexity and burden instead of reducing it. And so Clover's focused on simplifying care, improving outcomes, and helping physicians focus on what matters most, the patients. I'd say what makes us really different, though, is that we're not just tech. We're also care delivery. If a patient is struggling and our outreach team can't get through, we don't stop at a phone call. We have a clinical team that shows up in person and will be present for their entire care journey. We meet patients where they are physically and emotionally. And it's that coordination and integration between smart technology, AI, and human touch that makes Clover so unique. We connect data to the bedside or the living room and make sure no one falls through the cracks.
I love that. And having both is critical to really deliver that care that a lot of folks need. Why do you think what Clover Health does is more important than ever today?
We're facing a healthcare system that's more complex, more stressed than ever. Our population is aging, complex chronic disease is on the rise, and many of our communities still really struggle to access high quality care. And so one of our practice's patients comes to mind. This gentleman, seriously ill with metastatic prostate cancer, and his family was just too overwhelmed to even pick up the phone. The patient's wife, who was his primary caretaker, similar in age, also with many chronic conditions, had a full-time job and was struggling to balance caring for her husband and maintaining the income they so needed. And so because of this overwhelm, they were just paralyzed. And so the wife couldn't even bring herself to pick up the phone when we tried to call her. And so our nurses showed up in the home. They took the time, sat with her next to her on her couch, listened, and helped the family take those small, manageable first steps forward to ensure that they got all the support they needed for both the patient and for her. So Clover Health, really, we're stepping into that gap between patient need and care delivery. And we do that by equipping our primary care physicians with tools and insights and trusting them to deliver those better outcomes. And we show up in the homes ourselves to provide that ongoing clinical support from our interdisciplinary team. We have physicians who are board certified in geriatrics, in palliative care, in psychiatry. We have nurse practitioners, medical assistants, licensed clinical social workers who specialize in behavioral health, and nurse care coordinators. And it's that entire team, that village, that takes care of every patient, every member who has a need. Because really it's about making healthcare more proactive, more equitable, more personal, and ultimately just more human. And in today's environment, that mission couldn't be more urgent.
I love that and totally agree. We need more of this type of human care. I know it's like crazy that I'm saying human, but the reality is a lot when you start involving tech and you start getting fancy with things, you get away from the human. So it's so great to hear that you guys are human first, taking care of folks, meeting them where they're at. And one thing that I really love to do, Dr. San, is help connect the dots for our listeners, because if there's opportunities for partnerships and ways to work with you and your team, who is it that you're seeking to partner with out there? Who's your ideal partner, your ideal customer?
I would love to talk to anyone who shares in the same belief that there is a lot of work to be done in the home-based universe and really wants to enable and trust physicians with the choices they make, as well as wants to partner and integrate to ensure that we are providing a holistic level of support for any and all of our patients. I like to sometimes joke with our care teams that we love to smother our patients with care, but really it does take a lot of effort, coordination to ensure that our patients get the type of care that they need, and really that's on their terms. And so welcome any inbound conversation, partnerships of people who share that similar mission and really want to improve every life in the home, working with a physician network, with our providers to really improve every life.
That's outstanding, Dr. San. And to be clear, is it folks wearing a provider hat? So health systems that you're mainly interested in, provider groups?
Yes, in the sense that we share our patients across various settings. And so I've noticed anytime that there is a transition, whether it's office to home, hospital to home, specialist office to PCP office, all of those transitions are areas where there can be loss in communication. And then many times there's rich information in the home that would help that ecosystem understand why the choices that are being made. So just thinking about having been in that busy PCP office, seeing 30, 40 patients at a time, the easy button is to increase the dose of medication, add another medication. Whereas really the information that would be helpful to me is, hey, this person didn't pick up their medication, as it does through Clover Assistant, would tell you that, where you can then have a conversation as to delving into why that might be the case. And then the other piece there is, instead of just letting a physician know that there's a problem, then also providing a solution, right? And so our solution, again, being able to deliver care in the home, I think would be really valuable to everyone who's in that ecosystem of care delivery across all settings.
That's fantastic. Thank you for that. Appreciate you clarifying. And look, if folks want to reach out to you, Dr. San, to learn more about you or to learn more about how it could work with Clover Health, what's the best place that they could reach out?
The best way to learn more about Clover Health is through our website, cloverhealth.com. And then to reach out to me would be through LinkedIn. I'm responsive on there, and then also check email somewhat obsessively.
I love it, Dr. San. Really appreciate you sharing the different ways that folks could get in touch with you. And for everybody listening, thanks for tuning in. In the show notes, you're going to find all the ways to get in touch with Dr. San and Clover Health that she shared. Today is the day. Now is the time to take care to the next level. Meet patients where they're at. Let's follow the advice of Dr. San, the inspiration that she and her team at Clover Health have given us to do more with what we have. Dr. San, thanks for joining us. This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.